So I'd like to ask Alison Davis, who many people know, Head of Innovation, Research and Development at KMCS, and she's going to tell us a little bit about transferring the practice and challenges and solutions.
Thank you, Robert. Hello, thank you for inviting me. I've just got 5 minutes, very brief, just to talk a little bit about some of the challenges, specifically in Kent, but also some of the work that we're doing, and perhaps the way forward for Kent, having listened to what we've just heard, particularly from Scotland. And I like the bit about a dedicated plan for telehealth and telecare. We actually did have that at one point in Kent. We no longer have that at the moment, but I think it's a way forward for us. This in front of us is, oh, I can see it there. I'm doing that, sorry, I didn't realise it was there. So this on the screen is the Kent and Medway vision. It's about a range of technologies, using technology across the whole of the pathway, whatever that technology may be. It's not necessarily related to just telehealth or telecare, but it's about telemedicine, the use of apps, the use of light touch persuasive technologies at the bottom end of the spectrum, you know, lower cost, high volume technologies working around the prevention agenda. But also right up at that top end using telehealth and other technologies for those people with complex conditions, that top 5%. And I think it's probably fair to say in Kent that our focus has been, in the main, focusing on those top 5% people, families. What we want in Kent is the right technology given to the right person at the right time. Doesn't matter what that technology is. It's not about one size fitting all, because one size does not fit all. Some of the challenges that we have in Kent to pace and scale, I think one of the challenges that we have is a bit of a complex health and social care landscape, and particularly over the last 2 years when health has gone through massive transformation. We've now got 7 CCGs, if I just stick to Kent, 7 CCGs. And I think one of the challenges is getting the benefits of doing things at scale whilst maintaining that local focus for clinical commissioning groups and what people need in a local area. I think one of the second challenges is around ensuring that we realise the economic benefits. We've seen the research, and actually it's not been very good around the economic benefits for the use of telehealth and telecare. We need to make sure that we get the right model in place so that we can realise the economic benefits of utilising telehealth, and we can bring those benefits, and we need to be able to bring those benefits back into the system, and I think that is a real challenge. And I'm not just talking about the pounds, shillings and pence here, as in the savings, but it's also about increasing capacity within the workforce that we've already got. I think another challenge is about here in Kent, increasing the uptake of telehealth across the system. It is very patchy at the moment. In some areas we've got really good usage, but in other areas we haven't. So how can we increase the use of telehealth? And how can we focus the technology further down the pathway? So focusing more on short-term telehealth, on those people with rising risks or those people who have been newly diagnosed. How can we use short-term telehealth differently in the pathway? Because as I said, we tend to be focusing in Kent on those top 5%, those more complex patients. One of the other challenges is we've got a legacy system in place. You know, we were one of the 3 sites who took part in the largest randomised control trial in the world. Now, but it did give us a bit of a double-edged sword, I would say. So we have got a legacy system in place. At that time, we did deploy telehealth and telecare. We didn't make the distinction between telehealth and telecare. But since the transformation of healthcare over the last 2 years, actually we did split telecare, and telecare went to Kent County Council, and telehealth stayed within the health sector. We've got old kit now, so we've had it a little while. And the model that we had and we have currently is a capital model of procurement. So we buy the kit at the moment. That is not the model that we would want moving forward. I think one of the things that this did is it meant that it gave us the challenge that technology became an add-on rather than an integral part of the patient pathway and a part of the solution and part of transforming a whole service. So we had little system change, but we brought technology in. I've already mentioned the split of telehealth and telecare, and what that is a false distinction, and we need to put that right. The other element is that I think the challenge is a procurement challenge. There's no tariff for technology. It's very tricky to work out how you pay for technology. Would we want to go out to a procurement for telehealth or telecare separate to transforming the pathway? In Kent, we've said no, that's not a way that we think it would be a good way to move forward. So whose responsibility is it? One of the challenges is it the provider's responsibility? Is it the patient's responsibility? Is it a commissioning responsibility? Another challenge is around the contracting, the procurement challenge is around the contracting mechanism that we use. We don't want to go out wholesale just for a technology procurement because we want to make sure it's embedded totally in the transformation and it's part of the solution. So how do we develop a new whole system contracting model? A contracting model that looks at shared risk and reward between providers and commissioners. And how do we encourage organisations to work together, including the industry? So we're talking about developing that mature strategic partnership. I think my last challenge is about technology. The possibilities are endless with technology, and technology's over here. And I think we are lagging behind our systems and our processes, and some of the ways that we work and the protocols that we work to are actually behind. We need to catch up, and we need to catch up quickly. That's the wrong way. So what are we doing now, and how do we transfer that learning? I think we need a whole system approach, and I think, I was interested in the Scotland examples. Could we have a Kent-wide digital health programme? Would that be an approach that we could take? This is a large-scale change programme, and I think actually what we've done is we're embedding it into our integration of health and social care programme and aligning it with the pioneer bid that we've got. We need to bring the telecare and telehealth and stop making that distinction, bring that back together, and we need to see that technology is part of the solution to transformation and improving self-care. So I think there's something about us building the infrastructure, so workforce development, provider development and market development, and we're doing that at the moment. Developing strategic partnerships, working with the university, looking at that evidence base and what works, working with industry, developing different solutions to our local needs, and also working together with the AHSNs to maximise the solutions locally. We are rolling out technology along the long-term condition pathway, and we're focusing on self-management and self-care. As I said, trying to bring it further down the pathway, not just focusing on the top 5%. We're looking at alternative pathways in secondary care. So how can we use the equipment that we've got or something similar in different ways? So looking at alternative pathways to the long-term condition pathway, and we've got 2 programs going at the moment, one around postural hypertension and one around renal care. We are trying to get a critical mass so that we can maximise the benefits. And we are using telehealth in GP practices with the practice nurses. Practice nurses are now identifying people who they could use short-term use of telehealth on. And that is in about 4 practices at the moment. So not very many, it's just at the start. We have got a few other pathway technologies that we're looking at. One of the things that's really important is developing new business. And we've got a company who have developed a asthma device, and it's a cough counting device. And what it does is it identifies the increase in coughing in a small person, and then they know that then they need an intervention in order to stop their asthma exacerbating. We've had, across the whole of Kent, clinicians are very, very interested in this, and it is going to be moved forward within the next couple of months. We're developing apps in diabetes and for diabetes and asthma, and as you know, we've got the telemedicine in stroke and end of life. And that's it.
Thank you, Alison. Well, isn't it a bit of a shame that we've split telehealth and telecare? Obviously, Scotland listened to us and took notes. Unfortunately, we've got to now come and bring it back together again. So that's really important. It's also an issue around the age of the kit, which is quite interesting. But of course, now in the new marketplace, actually, it's not technology that's the problem. It's actually how we use the technology. The solutions are all there. So one of the tweets was, the solutions are boundless. Well, actually, they are. We've just got to have a new culture of innovation that takes us to move in a different way.